Attention deficit hyperactivity disorder is also something that is very common in today's society. So you're going to see a lot of children who have attention deficit hyperactivity, and now the latest phase is, of course, attention deficit disorder of adult onset. Most of these are individuals who probably had attention deficit disorders when they were younger, but now that they're older, they're recognizing the symptoms and they're getting diagnosed now as opposed to 20 years ago. So, in order to have a definition of attention deficit hyperactivity disorder, these are children who basically have deficits in one of three areas, if not all of them. They're going to have problems with attention span. They're going to have problems with impulsivity, and of course, they're going to have problems with hyperactivity. And it's not enough that you have problems in these areas. These problems have to be severe enough that are going to affect your social and or your academic function. Because of the inattention, because of the hyperactivity, you're not doing well in school and you're failing. Because of the inattention, because of the hyperactivity, or because of the impulsivity, you're having problems at home, you're having problems relating to other children. Usually the children are under the age of 7, and the symptoms must be present for more than 6 months. What is also essential in the diagnoses is that these children must have deficits in at least 2 or more areas. And that's important because when you look at questions, what they're going to do is that they're going to tell you about a child who's okay at home but has these problems at school. That does not exist in attention deficit hyperactivity disorder. You either have the problem or you don't. You can't be disruptive at school and then go home and be able to watch TV for 8 hours. If you can't pay attention at school, then that has to translate into not being able to pay attention at home. So these are kids who have problems both at home and school. And if they're older, then of course you're going to have problems in the work setting as well. They really don't know what causes attention deficit hyperactivity disorders. There's numerous theories, many of which have yet to be proven. But one of the things that they do agree on is that these are children who probably have problems in the neurotransmitter levels, whether it's norepinephrine or dopamine, whether it's too much or too little, and that's why the treatment usually is aimed at correcting these neurotransmitters where they think they have the deficits in. It is relatively common. It affects about 5% of school-age children, but much more common in boys than it is in girls at approximately a ratio of 9-to-1. Now, when we look at the family history, it is very common to see parents who have ADHD kids who also were ADHD themselves, who also had conduct disorder themselves, who also have antisocial personality, have mood disorders, or have substance abuse disorders. Because what typically happens with many children who have ADHD, and this of course does not mean that every child with ADHD will have this presentation, but you have ADHD, because of the learning deficits, you have behavioral disturbances, now you get diagnosed with conduct disorder. You're still not getting better. You now turn 18. Now you get diagnosed with antisocial personality disorder. Now you abuse drugs. You abuse alcohol. You have children. What do you think will happen to your child? Your child, of course, is also going to be at risk of developing ADHD, conduct disorders, and everything else, very much like you did. Most of these disorders are going to be diagnosed when the child goes to school. The reason being that when the child is at home, parents tend to be more permissive. If the child runs around and does all kinds of crazy things at home, the mother, the father, the grandmother, the grandfather, or the babysitter is more likely to let it go. But what happens when the child goes to school and there's structure and they have to sit still in class and they have to stand in line and they have to raise their hands in order to be recognized? Because of the ADHD, they cannot do it. And that's why most of them are diagnosed in the school setting as opposed to the home setting. And a lot of these children get better and never have ADHD again, but about 1/3 of them will continue to have symptoms into adulthood. The main symptoms that you typically find in ADHD will be the inability to sit still, the problems with your attention span, the inability to sit down and watch TV for hours, the inability to wait in line. So when the teacher says, all right, boys and girls, we're all going to the cafeteria, you have to push your way to the front of the line. When the teacher wants a volunteer to do something in class, you're the first one to raise your hand and you're the first one to bully your way to the front. And what happens? The teacher is probably tired of you, picks you, and you do not follow through. You do not finish the assignment. You do not do what the teacher asks because your attention is now gone. Because of your inattention, you don't listen to the teacher. Because of your inattention, you can't complete tests. Because of your inattention, you cannot complete your assignments. So what happens when you go home and you try to play with your brother or your sister, or you try to play with the neighborhood kids? You can't, because you're constantly going to have the same type of problems. So these are kids who have disruption, again, at home as well as in school. Because of the school problems, you're going to have the self-esteem issues. You're going to have the impulsivity issues. You're going to have the behavioral disturbances, which can lead to diagnoses of substance abuse disorders, mood disorders, propensity to violence, etc. As far as diagnostic tests, there are really not that many, and if there are, you are not expected to know them on this examination. There are certain scales that the parents do and the teachers do that are helpful in determining whether or not these children have attention deficit hyperactivity disorder, but there's no blood test or CT that you can do in order to give you that diagnosis. As far as differential diagnoses, you want to make sure that this is not necessarily age-appropriate behavior. You want to make sure that this is not autism, make sure it's not mental retardation, and of course make sure that this behavior is not a result of the child acting out because they have a sibling, because the parents are getting a divorce, or any other kind of stress at home. Once you fully diagnose the patient as attention deficit hyperactivity disorder, then several things should apply. Ideally, in the perfect world, the school setting would be such where these children would be in special classes, where they would not have to focus for such long periods of time, where there would have more breaks, more flexibility from the teacher. However, that usually is not the case. So what typically happens in the treatment of these children is that you're going to use pharmacotherapy. And the drugs that you're going to use are drugs that will affect the neurotransmitters. It affects norepinephrine and it will affect dopamine. And what these drugs will do is that they will increase the levels of these neurotransmitters, because by increasing the level of norepinephrine and increasing the level of dopamine, what you're technically doing is that you are allowing that child to focus and allowing that child to not be as hyperactive. Because by focusing, you reduce the patient's behavior and you allow them to calm down. So the drugs that do that would be the psychostimulants. For example, methylphenidate is one of the drugs that is given. However, it has to be given in children who are over the age of 6. Dextroamphetamine is another drug that is a psychostimulant, and that has to be given in children over the age of 3. There's a newer drug on the market which is mostly as an antidepressant. However, it's used for the treatment of attention deficit hyperactivity disorder, and this is atomoxetine. So atomoxetine, the psychostimulant, and there is another drug called modafinil, which doesn't have FDA approval as of yet, which has been used. For the purpose of the exam, your choices will either be the psychostimulants or atomoxetine. If both are given as choices, the question will focus on, even though they both have the same efficacy, as far as safety, which one is the better answer? Atomoxetine, of course, would be the safer one. Why? You don't worry about addiction. You don't worry about these children selling the medication. You don't worry about these children having their urine tested and come back positive for amphetamines. So from a safety standard, atomoxetine is much better. From an efficacy standard, they all work basically the same. Another thing that's essential for attention deficit is that when it's the end of the school year, most of the parents opt out to not give the medications to the children during the summer. So you let the kids go on what's called a drug holiday, and when the school season starts again, you reassess them. And once you reassess them and determine they still need treatment, then you put them back on it. If they don't need treatment, then of course you withhold the medication. Other treatments that are viable could either be antidepressants or clonidine, but the number one answer will either be the psychostimulants or atomoxetine for attention deficit hyperactivity disorder.